Alright, Stefan Hartman here, Iron Direct Primary Care. I'm here with Derek, Master Trainer and owner at Freedom Fitness. We're talking today about our weight loss program and our collaboration here.
Yes.
So, Derek, if you want to explain to a little bit about what Progressive Resistance Training Program is, what is PRT?
Sure. So the progressive resistance training obviously is we're breaking the muscle tissue down, and then we will obviously want to rest, recoup, let it heal and grow. Obviously, with the more muscle mass you have, the more calories you're going to burn, the more fat you're going to burn. So everything is pretty much customized, specifically for that client. Everybody's different. Everyone responds different to different stimulus. People have injuries. People have other things going on that we have to take in consideration. So everything's pretty much geared to specifically for that client.
Exactly. And I have this at the top of the list here because the Iron and Iron Direct Primary Care stands for lifting weights, right? That's always been the goal with what I'm doing. It's a muscle-centric medicine approach. Muscle is an endocrine organ. Think of it like your pancreas, right? We treat diabetes, we treat weight loss. We have to think of the muscle for that purpose, but for multiple purposes, right? Even think of it as making yourself more difficult to injure, right? As you age, you get weaker, frailty, bone fracture, and so forth. You want to have a robust support system. You're going to get that through a robust musculoskeletal system, supports your own bone structure. So it's critical towards the anti-aging process. If we're practicing anti-aging medicine, we have to focus on the muscle.
Correct.
So PRT program is essential. Now, for the patient who is looking to grow muscle, you have to make sure the hormones are optimized. That's why Derek's brought me on here. It's to help optimize his patients, make sure that, when he is training a client, that they are progressing.
Yes, and I've noticed within the past 5 years, hormone levels in male and female are all over the place. And I think a lot of it's due to a lot of the foods that we're eating, things like that. So obviously that's a huge issue. I could write you up, have you the best PRT and nutrition, but if your hormone levels are off, it's like fighting a double-edged sword. So that's when Stefan would come in, get your blood work done, see where you're at, and fix that problem.
Exactly. Hormones include testosterone for females as well. It's not known as the male hormone, but women need testosterone as well. Estrogen, progesterone ratios, these are more important towards women, making sure those are well balanced, especially as they age. Postmenopausal women, they struggle with hot flashes, osteoporosis, osteopenia. This is usually from a lack of estrogen. Progesterone deficiency. Progesterone, it is neuroprotective, so it protects against cognitive decline. It's anti-inflammatory, helps you feel a little bit better.
Deprivation.
Sleep deprivation is crazy as well. Growth hormone and thyroid hormone, kind of overlooked a lot, but growth hormone is integral towards obviously muscle growth. Again, weight loss. I guess is neuroprotective, protects your brain.
Rebuilding cells.
Cells, yes. And then thyroid hormone. I see so much thyroid issues in my practice.
I'm seeing it more and more now too.
Insane, and it's because of the chemicals we're putting in our body, what we're ingesting, or we're exposed to the air we're breathing. It's disrupting our thyroid hormones.
100%.
You really struggle with energy and
It's
with the bad
It's hard as
thyroid.
a trainer because if you don't know where these people's levels are at, they're getting frustrated because they're not seeing the results. You as a trainer are getting frustrated because you're doing everything you can to try to help these people, and it's because their hormone levels are off. Once you have them fixed, it's night and day.
It goes a lot easier.
Oh, a lot easier.
We're going to talk about nutrition. So Derek, he helps build a nutrition program for patients, helps them with the weight loss. I also look at it from an autoimmune perspective. I see a lot of patients with autoimmune disease, so I do some counseling there to help teach patients what is maybe triggering your autoimmune disease. If you have autoimmune thyroid process, arthritis, you're having a skin condition, often the things that you're putting in your body, food, what you're mostly putting in your body, is going to affect your disease process.
Correct.
So that's pretty critical, is the nutrition aspect.
Absolutely, yeah. It's huge.
Huge.
As far as weight loss and training, you can't outwork a really bad diet. So
No.
nutrition's 80%. Very, very, very important.
It is. Supplements. Certain patients do need supplementation, and we do laboratory analysis. We can do as advanced or as affordable as you'd like, to go as detailed as you'd like into this. But also through my clinical exam, my experience with looking at patients, I pretty much know what they're deficient in based off their symptoms, how they're feeling, their disease processes, their thyroid function, their hormone function. I know which supplements they're going to need, and so I do make recommendations for supplements as well.
Correct. Which is good. It's great because people don't really understand what the supplements do, and either supplements that are out there that actually can help them.
Right. So I have a network of compounding pharmacies that can make us injectable medications for nutritional supplementation. We can do IV therapy. We can even do oral supplementation with quality brands that actually get into the body and do what they're supposed to do.
Right.
Next are peptides. So peptides are very interesting and they really help for patients with weight loss, specific peptides. We talked about the GLP-1s like semaglutide. They really help with that weight loss process by decreasing appetite, improving insulin sensitivity. Really helpful for the diabetic patient, but a lot of patients can benefit from that. And there's other peptides that can support your hormone process and your ability to burn fat. Growth hormone secreting peptides are huge, amazing for the aging patient. Struggling in the gym, struggling with certain things. A little bit of growth hormone peptides stimulate the pituitary to do what it's supposed to do. Can be a game changer.
No, it is for sure. I've seen it.
Yeah. Cardio and HIIT. We were talking about this other day. Conventional wisdom is get on the treadmill, work hard, burn off that fat. What do you think about that?
For me, cardio is as needed. A lot of people go over and beyond the cardio. For me, the cardio, you're going to burn calories, but cardio for me is let's keep everything moving. Obviously we do need cardio, for your heart and lungs and things like that, keep your conditioning up. But it's not tell-all, it's the diet's going to do majority of the work. If you're doing too much cardio, and I know some people, even competitors at 2.5 hours of cardio, and they're already on a depletion diet. So you're going to start depleting muscle at that point, which we don't want to do because muscle is your best friend as far as fat burning power. So, we got to, and again, it's going to depend on the client how much cardio they're going to need.
Yeah, in most conventional doctor's office, they'll just tell patient, I just walk more, right? I see that all the time. Yeah. Patients like, I walk all the time, but they're still struggling with the weight issue.
Correct.
So it doesn't work for a lot of people.
It doesn't because, the thing with cardio is, when you're on the cardio machine, you're burning calories. When you get off the cardio machine, you only have a few hours that your metabolism's going to stay up. Whereas if you're strength training, you can keep your metabolism up burning calories up to 24 hours. I don't know where to go. So that's a night and day difference.
Huge difference. Just a more muscle-centric approach rather than a cardio approach.
Exactly.
Right? Yes. HIIT training. I like HIIT training myself. I do that in tennis, kind of intuitively, right? That's what tennis is. It's HIIT training the whole day long.
Yes.
But do you incorporate some HIIT training for patients?
I do, especially with my weight loss clients. Like a lot of my 3 times a week clients, we'll do like a full upper body day, a lower body day, and then we'll end with a HIIT day, a full body HIIT.
Yeah. I like that in my workouts, doing like a back and chest at the same time. So I'm always working in the gym, not sitting around on my phone. I'm actually doing stuff.
Still doing push-pull.
That's high intensity interval training for me. I get my heart rate up doing that.
Yeah. Especially if you're supersetting, doing drop sets.
Yeah. Oh yeah. Let's see, expectations, right? So what can people expect? How long is this going to take? Are they going to is this a quick weight loss scheme?
This is not a, hey, 12, in 1 month you're going to get to where you want to be. No, It's not going to work.
No.
You're looking anywhere from 3 months to 12 months, depending on, how strict you are and how much work you're ready to put in. It takes a lot.
It takes a long time.
It does, especially to put on muscle. You'll lose fat a lot faster than you will put on muscle.
Yeah.
So
to really start seeing results, you have to be patient. You have to trust the process. 6 months to a year. It took a while to gain this fat. It's going to take a while to come off. Yeah.
Correct. And to do it right.
Yeah. Let's see. Discipline, consistency, dedication. We were talking about that the other day.
Yes.
And so coming on board here and signing up for a program with you, that's a dedication, right? You're
correct.
Putting a financial investment in your health.
Correct.
And you're also making a commitment to it.
And a lot of people need that. Hey, I know I'm paying somebody. I know somebody's waiting for me. I need to show up.
You need to show up.
Where if they didn't have that, a lot of times you'd be like, you know what? I'll go tomorrow.
Good money, right? So you get you,
So
you
you
know
have
you
that
have to make
dedication.
that appointment. You can't skip it. There's no excuses. You're gonna get there. You're gonna do it.
And it's something that, like I said, with the consistency, it's got to be a consistent thing. You can't come in here, 2 days, and the next week come in 1 day, and it's not going to work. It has to be consistent.
Exactly. Consistently and progressive betterment. We talked a little bit about cost. So Iron DPC membership, obviously you enroll in my practice, become a patient of mine. So, I'm available for text messages, calls, telemedicine, in-office visits here. So I become your primary, holistic primary, anti-aging primary, kind of like all in one. So that's the benefit of, joining my practice. Then additionally to that, laboratories, obviously imaging, anything we do outside, that's not included in my membership. I have a basic membership, it's $50 a month for one person. The whole family can register as well. Obviously anything peptide supplements, that's not included, obviously.
Correct.
And then for you, on your component, they join Freedom Fitness here.
Yeah, you can join our gym. You become a member. We do accept almost all the insurances. We have different types of packages. We are a 24-hour gym. And as far as clients, if you hire a trainer, we have a special rate for you as well for the gym membership.
Cool. And then what can patients expect? How many days a week are they coming in with you? How long are they training?
Again, it's all going to depend on the individual. What they can afford. So it's going to depend.
Exactly.
Obviously, I don't want this to be a financial burden. Because if you're focused on the money part, you're going to be stressed out. It's not going to work. I want you to come in here, enjoy the training, and enjoy this process.
Exactly. Yeah, a lot of anti-aging institutes, functional medicine are very unaffordable out there. My practice is super affordable.
Very.
I'm a PA, conventional medicine trained. I've worked in neurosurgical specialties, urgent care, emergency medicine, psychiatry, family medicine. So I bring a good amount of experience with me conventionally, but I also have a holistic background. I was a master trainer before. I know what you do. I know it's a quality work that you do. Seeing you in here with your clients, and so I bring a lot to the table, a lot to offer. And the gym here is, it's one of those classic bodybuilder gyms.
Yeah, this is a gym where the people that come here are here to train.
They're here to train.
Not here to mess around. I mean, we have a good time. We have a great bunch of members and staff here, and it's a great atmosphere.
Cool. I hope that gives some valuable information about our weight loss program here, and I hope you guys are interested.
Yeah, and I also offer free consultations, so if you'd like to set one up, just let us know. That way we can kind of get a little more information